Okay, think about this for a second. What if the most powerful thing you could take for your health wasn't a pill, but a pepper? What if your doctor could write you a prescription not for medication, but for actual meals? It sounds a little out there, right? Well, this idea is quickly moving from the fringe right to the forefront of healthcare. So let's dive in. We're going to explore this whole concept of food as medicine. We'll unpack what it really is, dig into the hard evidence to see if it actually works, and try to understand why it's attracting literally billions of dollars in investment right now. So, what are we actually talking about here? It's important to know this isn't just about your doctor saying, hey, try to eat healthy. The official definition is really specific. It's all about integrating healthy food directly into a patient's medical treatment plan, with real oversight from the healthcare system itself. And it's not a one-size-fits-all approach. Think of it like a pyramid. Down at the base, you've got these broad programs that help whole populations, things like SNAP. But as you move up, the support gets way more personal. A produce prescription, for example, might be a voucher you can use for fruits and vegetables. Then you get to the very top, medically tailored meals. These are the most intensive. We're talking fully prepared meals designed by a dietitian for one specific patient with a complex chronic illness. Okay, this all sounds great in theory, right? But here's the billion-dollar question. Does it actually work? This is where we need to put the evidence on trial, because the promise is huge. But the data? Well, the data tells a really fascinating and kind of complicated story. Let's start with a star witness for the prosecution. A massive observational study in Massachusetts looked at a ton of insurance claims and found something absolutely stunning. Patients who received these medically tailored meals had a 49% reduction in hospital admissions. Let that sink in. That is a massive number. And here's where the central puzzle really comes into focus. On the one hand, you have that incredible data we just saw, fewer hospital stays, a 16% drop in healthcare costs. But then, you have a major randomized clinical trial from late 2023. Now, in this trial, the group getting the special meals did see their blood sugar improve, their HbA1c, which is a key long-term marker. But get this, so did the control group, the people who didn't get the meals. So the takeaway, right from the study's own conclusion, was pretty surprising. It suggests that just being more involved in the healthcare system, seeing doctors regularly, might be enough to improve some key health markers, even without the intensive food program. Now, this doesn't mean the food didn't help, but it definitely complicates the story of how it helps. So the clinical picture is, well, it's complex. Food as medicine clearly helps people, but maybe not in that direct one-to-one way that researchers first thought, which makes this next part even more interesting. If the clinical results are mixed, what on earth is driving the more than $8 billion in national commitments to these programs? Well, the answer, it turns out, might have less to do with individual lab results and a lot more to do with the absolutely staggering economic case. So let's follow the money. A major study from Health Affairs ran the numbers, and what they found is almost hard to believe. They projected that if these programs were rolled out to every single eligible patient in the country, the U.S. could see annual healthcare savings of nearly $24 billion. And that massive number is tied directly to this: preventing over 2.6 million hospital stays every single year. The whole economic argument is that simply keeping people out of the hospital in the first place is where the real game-changing savings are. And these aren't just some abstract national figures. When you zoom into the state level, the impact is just as huge. In Connecticut, for instance, the model projects an annual savings of over $6,000 per patient. That's the kind of number that can totally change a state's budget. Okay, so the economic case is a powerhouse. We're talking billions in savings, millions of fewer hospital stays. It seems like a total no-brainer. Which, of course, raises the obvious question, why aren't we doing this everywhere, right now? Well, as it turns out, the real-world challenges are pretty significant. The reality is, there are still some major hurdles to clear. We have research gaps. We really need longer, more robust studies. Your average doctor gets almost no nutrition training in med school. Getting data out of electronic health records is a nightmare. And then you have these huge systemic barriers, like agricultural policies that actually subsidize the very ingredients we're trying to get people to eat less of. It's complicated. But even with all those hurdles, you can really feel the ground starting to shift under our feet. The entire conversation is changing, and it's changing at the highest levels of policy. And you don't have to look any further than the upcoming U.S. dietary guidelines. The old advice was to limit added sugar to less than 10% of your calories. The proposed new stance is basically a bombshell. It says no amount of added sugars is recommended. That is a fundamental night and day shift in official guidance, and it signals a much tougher line on what we consider a healthy diet. So, after all of that, where does it leave us? We've seen the incredible promise, the clinical complexities, the sheer economic power, and the real-world hurdles. Let's try to weigh all the evidence and see what the future might really hold. I think this scorecard really helps clarify things. The evidence is strong that these programs absolutely improve what people eat and they reduce food insecurity. No question. It's moderate for reducing hospitalizations and healthcare costs, at least based on the studies we have so far, and it's weak or mixed when you look for those consistent, direct improvements in specific clinical markers like blood sugar across every single study. So what's the real takeaway here? What do we know for sure? Well, we know that diet-related diseases are a massive crisis. We know these programs work at getting healthier food to people who desperately need it. The potential for saving money is undeniable. And this represents a proactive shift in a system that mostly just reacts to sickness. But, and this is a big but, we still need more and better research to really iron out all the detail. And let's be very clear, the stakes could not possibly be higher. This is not just a U.S. issue. According to the World Health Organization, diet-related diseases cause 41 million deaths across the globe every single year. The scale of this problem is just breathtaking. Which leaves us with one final and absolutely critical question. The evidence seems to show that food can be medicine, especially when it comes to preventing those incredibly expensive hospital visits. But if this really is the future, who's going to foot the bill? Is it going to be insurance companies, the government, through programs like Medicare and Medicaid? Or is it going to require a complete rethinking of our entire healthcare and food systems? That is the multi-billion-dollar question that's still left on our plate.